Welcome back, everyone. October is ADHD Awareness Month, and ADHD affects how the brain works. It can take many forms. People with ADHD may be challenged with inattention, hyperactivity, and also impulsivity. ADHD is usually diagnosed during childhood. In fact, it is the most common mental condition in children. Around 6 million children ages 3 to 17 years old have been diagnosed. 6 in 10 U.S. children with ADHD also have at least one other mental, emotional, or behavioral condition, such as anxiety or depression. So Ride the Wave Therapy in St. Augustine is offering new services for parents of children with ADHD. So Shelley Sharber and BCA Director Danielle Hodut join us this morning. We appreciate you both for being here.
Thank you for having us.
Absolutely. So first, children with ADHD can often experience a secondary diagnosis. Can you share more about the therapy that you offer and really how it can help families?
Ride the Wave offers occupational therapy, speech therapy, ABA services. There's a variety of situations that can arise in a child's life that directs them into different support services. Danielle is our occupational therapist, and she can go into some of the descriptions and diagnosis, things like that, that can help explain to parents.
Yeah, please do, Danielle.
Okay, so we have, we'll often see children with ADHD. A lot of times they'll have other diagnoses such as oppositional defiance disorder, autism spectrum disorder. And so we have speech therapy, like Shelley said, speech therapy, occupational therapy, and behavioral therapy, and we all work together. We really strive to work as a team and bringing all of our different therapies together to have the best outcomes for children.
And that's so important. We also know that coming up later on this month that you are offering a sport camp designed with specific needs in mind. Can you talk a little more about that so people know?
Sure.
Go ahead.
So our sport camp will be run by myself or another occupational therapist, and so we're designing it for parents who want their children to be involved in something like a sport, but maybe they have concerns that they may not be able to keep up with the other kids, they may not follow directions, or they may not be as coordinated. So we are keeping a smaller adult to child ratio and designing the program so that the children can have the full support they need to participate.
We also have a homework helpers club that we are starting, and that is geared towards ADHD struggles at home with parents who might be needing help, not in the way of academics, but in the way of, my kid, I'm struggling so much with getting my child to sit through homework and completing it. ADHD hinders children in so many ways, especially with getting homework done, and a lot of times parents are at a loss as far as what to do and how to get through it. So Homework Helpers is also something that's going to be directed by Danielle, who will help them understand different coping mechanisms to help them to focus, help them to be strategizing through how to get through their homework, and giving them strategies that they can take home and use at home with mom and dad.
So we have just about 30 seconds left. Now, if a parent thinks that their child may have ADHD, what should they do? What advice?
We'll definitely talk to a pediatrician. And I would say some of the less common signs that if you're not sure, there's the attention and the hyperactivity, but if you notice that your child is struggling maybe in social situations, they might be impulsive, they may interject in conversations, or they may avoid social situations because it's hard for them to follow the lines of communication. They may have emotional outbursts surrounding homework or chores, and they may have messy areas like their desk or their room, and they just don't know where to start to clean it, even though you've helped them many times. These are things that are normal. You want to normalize it, you want to know that other people struggle with it, and you want to get some help from a pediatrician or from things like our homework helpers, where we're really going to focus on the social support aspect, where it's a group setting and we're all in this together and we're all figuring this out together to increase our self-awareness to help us be successful with what we need to do and what we want to do.
I love what she just said about normalizing. That's the key. Making everybody feel like it is normal, because we all have things we struggle with, and bringing everybody together and normalizing it across the board is one of our foundations.
So before we go, if parents want to learn more, how can they reach out?
They can go to our website, which is www.ridethewavetherapy.com, or they can call our office at 904-217-3103.
All right, very important information. Thank you so much, ladies. We appreciate you being here.
For having us.
Bye-bye.